All right. So good evening. My name is Larry Fligelman. I'm the principal at Brownington Central School, and I want to welcome you all to a parent information session. And this is really going to be information from all of the K-8 principals, and then a chance to ask questions. And hopefully we can answer some of your questions, or at least work to find the answer to some of the questions. We're going to be talking about the in-school option tonight. And we'll schedule a separate night like this for the remote academy. We're also going to, stay away for the most part from very school-specific questions and let those be handled by those principals. We're all likely going to schedule a building-specific parent forum closer to the start of school. We ask that during the session you keep your microphone muted. Please, if you're on a computer, type right into the chat any questions or comments. All of that will be looked at. We'll answer every question we possibly can. And I'll make sure to stop during the question and answer session to give a chance for those on a telephone, a cell phone, to unmute using *6. *6 mutes or unmutes your Google Meet, and ask your question out loud. We will record each question, answer every question we can, and get the answer in the next few days and weeks to the questions that we can't answer tonight. Please consider keeping your video off to save bandwidth, although it's not a huge crowd tonight, but we're getting there. It's going up. And at this time, I would like to ask each of the principals, starting with Albany principal, to introduce themselves.
Hi, this is Steve Owens. I'm the principal of the Albany Community School.
Hello, everybody. Thank you for joining us. I'm Jenna Lawrence, principal at Barton Academy and Graded School.
Hi, I'm Angelique Brown. I'm the principal at the Glover Community School and also a co-principal with Larry Flegelman for the new remote academy.
Hello, everyone. I'm Paul Simmons. I'm the principal at Irisburg Village School.
Good evening. I'm Sherry Gentry. I am the new principal at Orleans Elementary School.
Hi, and I'm Mike Moriarty. I'm the Director of Instruction for all Orleans Central Schools.
Great, thank you, everybody. We're going to start with a few minutes of presentation on a variety.
Larry, you're muted.
No. We're going to start with presentation. Can people hear me? Can I get a thumbs up from one of the administrators? Yeah, there you go. Sorry, Mrs. Brown. We're going to start with presentations from each of the principals, not too long, to talk about some of the topics that we listed on the invitation for tonight. And then after that, we will open up for questions. As you have a question, if you're on a computer or an iPad, or you can figure out where the chat is on your phone, type the question right in, or keep track of it, and I will periodically ask anyone who has a question who can't access the chat to unmute themselves and ask the question. And so we're going to start with a little presentation about calendar changes from Mrs. Lawrence.
So as Beth Davis already sent out a message via Messenger to all parents and families in the district about the student day being pushed back to September 8th. This was a directive from Governor Scott. You will find a new school calendar updated on our OCSU website. For the first week of school, we will begin school for those first 4 days. Students will be dismissed 1 hour earlier, just to allow time for staff to kind of process how those first days went, and also to allow time for students to adjust to kind of the different changes of how the school day will feel and look. So this will all kind of depend on knowing that the legislature, when they resume at August, the end of August, that they will waive 5 student days. If that doesn't happen, we will have to revisit the calendar, but we are anticipating that that will happen. And Angelique will speak next about health screenings and transportation.
So I'm going to start by talking about some of the new bus procedures for this year, and they're based on the guidance put out by the Agency of Ed. You can anticipate that your students will probably have assigned seats. They may be asked to sit with or near a sibling. We're going to spread the students out as much as possible. We do have lower numbers on the buses this year because of the remote option that we're offering, and we encourage you to transport your children if you can. Transportation surveys are due for all parents who want their children to ride a bus on Friday. If you don't fill this out, the bus will not stop at your stop because they're really trying to figure out which kids are remote and which kids are in person, which kids want a bus option. So it's very important that you fill that out. These surveys went out to you through your building principal, and they're also on some of our Facebook sites if you missed them. Parents of bus riders are going to have to do health screenings on each of their children before the student can get on the bus. You'll be given a bus ticket, and you'll have to take your child's temperature and answer 2 questions with either a yes or no. The questions are, has your child been in close contact with a person who has COVID-19? And does your child feel unwell with any symptoms consistent with COVID-19? And the symptoms will be on that ticket. In order to get on the bus, your child must have the ticket in hand. The tickets will be pre-printed in packs, and they're going to be sent home to you. We'll send home a few by mail for the first week or so, and then we'll send home the rest with students when they arrive. All schools will also... Can we hold all questions until we're done?
Okay, well, I'm trying to get in on the Google Meet on my computer, and it's saying that I need to wait to be let in.
Mike, can you take care of that?
Yeah, I'll see what I can do.
Thank you. So all schools will also conduct their own daily health screenings on staff and on students. Bus students, when they get to their schools, will hand over their tickets, but they'll have to have their temperatures checked again. Walkers and drop-offs will have their temperatures checked, and they'll be asked the same questions that the bus students were asked. A staff member will use a no-touch thermometer to take students' temperatures. Any student with a temperature lower than 100.4 degrees Fahrenheit and who answers no will be allowed to enter. Any student with a temperature of 100.4 degrees Fahrenheit or higher will have to go to our isolation space. This is a mandate from the Agency of Ed. So we all have new isolation spaces in our schools. Students in the isolation space will have to wait there until a parent can come and pick them up. Sherry will cover more health information in a few minutes. Larry, you're up next.
Yes,
with masks.
sorry. I apologize for the delay in admitting people into the meeting. We had a plan that someone else would do all of the admitting, and I blew it by logging into the meeting first, and it meant that I had to admit them all. So I might get up again in a moment and go see who else is waiting. So I apologize for that. So much for our plan. And I'll just say that as a group of principals, we work really closely together, and we're learning that we make plans and then we make them again a few minutes later sometimes. So that's something we all have to get used to. So let me talk a little bit about some of the safety measures that we will be employing following the Vermont Health Department and Agency of Education guidelines. The first and most obvious one is that all students and all staff will be required to wear masks. So a cloth facial covering, we've purchased disposable masks if someone doesn't have their own. And there's a group that's donating cloth masks that we might be getting some cloth masks from. If you can, I recommend that you work with your child now over the next several weeks to find cloth masks that are comfortable, that you like, and that you can wash on a regular basis and take care of in that way. for my kids, personally, we've been experimenting with different masks. We have several for each of my children. I have 2 kids, so each one has 3 or 4 different masks. And I personally have done the same thing. I have several different masks that I'm comfortable with, and I'm getting more and more used to wearing one every day, and it's fine. If you have some sort of medical concern, there's a certification that you would need to get from the doctor that says a mask is completely inappropriate. So it's not just any condition. It's, if masks are going to be damaging to the child, well, obviously that's something, and that's something your doctor has to certify to have that kind of exception. The other main safety measure that we'll be taking is a set of distancing procedures. And in each building, it's going to look a little different, but kids and staff will be keeping their distance around 6 feet from each other, generally facing the same direction in a class is the guidance, really working to minimize how many droplets and how much virus go out in the air, so we keep kids safe and apart from each other. We'll be using spaces differently in each building, and each of the principals, will spend those extra days before school starts working with the staff to design building-specific procedures. How will each classroom look? What will be the flow of traffic? Will we mark 6 feet on the floor? And where will we stand for this? And how will we decide each thing? And that's something we're going to use our teachers to help us work through all of those details, because they know the kids and the building. We also are planning to use the out of doors as much as we possibly can for as long as we can. We know that snow could fly in October, occasionally earlier. We know that Vermont weather is what it is, right? So we'll try to use the out of doors as much as possible. We'll keep windows open, things like that, in order to keep kids and adults safe. And so now I'd like to pass it on to Paul to talk about parent drop-offs and meals.
Hello again, everyone. As you know, every school has their own procedures for drop-off in the morning and pick up at the end of the day. We'll most likely have some defined times this year so that we don't have a crowd coming in at once, so that buses and parents dropping off children are not at the same time. When students do arrive at school, whether they be on the bus or from parents dropping them off, they'll be going directly to their classrooms. Some may be entering in different ways. Some schools may have different doors that the students will be entering, and you will hear all about that from the different principals. For the K-8 schools, which we're talking about tonight, all snacks, the fresh fruit and vegetable snacks, the breakfast, lunch, they're all going to be delivered to the classrooms. Students will be eating either in the classrooms, or hopefully sometimes they'll be eating outside because they will need to be staying with their own group. Most likely, there'll be different procedures at each school for ordering breakfast and lunch in advance. And the guidance that has come from the Agency of Education has also told us that parents and visitors will not be allowed to go into the classrooms this year, which is very, very unfortunate. But we will have to go with that guidance for now. And Ms. Gentry, you are up next.
Thank you, Mr. Simmons. So I'm going to talk a little bit more about health. And it's very important that if students are sick, that they stay home. If during the day a student comes down with a fever of 100.4 or higher, or if they come down with symptoms of COVID-19, they will go to an isolation space, and each building has designated a room for that purpose. And they will stay there until someone picks them up. They will need to be fever-free or symptom-free for 24 hours. without medication before they can return to school. So that's very similar to our previous policy of being fever-free for 24 hours. They will be supervised in the isolation room, and we do have protective equipment for our staff to safely do that. After they leave, the room will sit for 24 hours and then be thoroughly sanitized. Our nurses are currently working on more building-specific protocols, so I would certainly expect you to have specific information a little bit closer to the opening of school. If there is a case of COVID-19 in the school, we have been directed to work with the Department of Health to determine next steps. That is the guidance that we're getting at this point. And I think that's all I have at this point. And now we're going to turn to Steve with information about sports and after school program.
Hold on a sec, Sherry, real quick. There was a question in the chat about how many students can be in the isolation stage at a time.
It is my understanding that that would be for one student at a time. So if we have more than one student ill, we would have to use other spaces and plan accordingly.
Hello, folks. So just yesterday, guidance came out from the state on fall sports and sports programs. We are at what's called level 2 right now, and all the schools are going to open at that level. And what it says is that where we are right now, school-based fall sports programs may initiate coach-led practice sessions, skills and drills work, and inter-squad scrimmages within your school program no earlier than the first day of academic instruction. Facial coverings are required to be worn by all players, coaches, officials, staff, and spectators at all times, including during active play. An exception is provided for participants in cross-country running. Of course, we don't have that at the middle school level in our schools. And then what they say is that 2 weeks after opening, there'll be a determination made whether we're going to move to a different level. Now, the one fall sport that we've been offering, which is soccer, is there's 3 categories of sports: outdoor sports involving no or low contact, outdoor sports involving short duration incidental contact, and indoor sports involving short duration, and sports involving high contact. Soccer is part of outdoor sports involving short duration incidental contact, and I'll read directly what it says here. Soccer and field hockey may hold team practice sessions, inter-squad scrimmages within your school program, and interscholastic games. Jamboree or tournament style play, one team playing multiple games versus multiple opponents in a single day weekend, is not currently permitted. So I think that there's a little difference here between what it says here and what it says up above about the ability of to do interscholastic play, and that's something that I'm going to need to look into, and we need to get further definition on. The other thing I'm going to say is our team was discussing the interscholastic sports yesterday, and we haven't made a final decision on how to approach it yet. But my purpose here is to let folks know this is the guidance that has come down from the Agency of Education. And if we were able to carry on soccer in the short term, for at least the first 2 weeks, I expect it would be intra-squad stuff only, everybody wearing masks, even when running. And that's what it would look like. And we're going to have to get back to you on how we are, as a supervisory union, going to handle interscholastic play were that to be an option. And I'm going to pass now. Oh, the other thing I was also charged to mention, after school programs. Currently, there's only 2 schools that actively have that going on, or a way to do that, Orleans and Albany. So that's kind of a school-specific thing. And we're going to send that to the meetings for the individual buildings so that the folks that don't need to hear the building-specific information don't get that right now. Also, we're going to need a little more time to figure out what after-school programs, if any, would look like in this scenario. I am going to pass to, I'm going to scroll down here, Mike, who's going to talk about potential shutdown plans and emergency remote changes. Thank you.
Thank you, Steve. So we, as you all know, last fall we had to shut down schools in March and really engage in what we called emergency learning. And so we've been actively planning over the summer for not only reopening, but for the case in which we would have to go back to remote learning. And one of the things that we have done is we've decided on a learning management system that we will be using. Most of you probably have seen your kids using Google Classroom, but this is what we will be using to access all learning in the event that we went into a remote learning again. And the way that we're going to do that, the way that we're going to prepare for that this year to make it a better experience is during the initial days of school when kids are back in the buildings, teachers will be working with kids to train them on how to get into their Google Classrooms, as well as have activities for them to do. And teachers will be doing their planning and preparation within Google Classroom so that in the event we had to shut down, we could easily switch to all remote. The other thing that we'll be doing the week before school is we'll be offering an initial parent training on Google Classroom. And we'll be doing that with a couple of teachers in the supervisor union, as well as we're looking to have some students be involved in that initial training so that we can have parents experience what it looks like from the teacher side as well as the student side. And then we will have follow-up Q&As and trainings for parents as the fall moves along. So that's really what we plan to do in the event that we need to switch back to remote.
So at this time, what we're going to do is we're going to take any questions that we can try to answer. And the plan was we would start with all of the dozens and dozens of questions typed into the chat. Currently, there's one. So if you're on a phone and you have a question that you want to ask out loud, in just a moment, what I'd ask you to do is do *6, and that'll let you speak aloud, unless you're already unmuted. But first, I'll try to answer this first question. Mike's going to read it out loud, I guess, and then I'm going to try to answer it. It's like a quiz show for me or something. But, I've got lots of friends to phone if I don't get it right. So, what's the first question?
So Larry, the first question was about the isolation space. Sherry answered that. So there would be one student at a time. Right. The next question is about bus surveys and where those can be found.
Right. That link was added in.
Oh, okay, sorry. And then the next question is, where did the standard of 104.5 degrees temperature come from for isolating kids? I work for a hospital system and our standard is any higher than 99.5, no admittance to the facility. Yep. Okay,
so the temperature is actually 100.4, and it came to us from the Vermont Health Department and Vermont Agency of Education. So it's, if a child has 100.4 or higher, then we're not to let them in the building or to isolate them until the parent can come pick them up. If they have that temperature at home, you should keep them at home. And that's, That's how that's going to work. So, what else?
Okay. Are temperatures being taken on or before children get on the bus, or is this happening when they get to school?
So there's actually a two-part system here. In order to, the rule for us is that we are supposed to ensure before the point of first contact that students can pass this kind of health screening. So in order to do that, we're asking parents, families, to take the temperature at home, and we'll give you a little bus slip, a piece of paper, a bus ticket, and you write on there, temperature check, cleared, whatever the wording is, and you say no to the questions, assuming the answers are no, and the child then gives that to the bus driver. The bus driver gives it to the school, whatever school they end up in. But we're also going to do it here at the doors of each school. And so we're going to check every kid as they enter the building. We've purchased contactless, touchless thermometers. And so we'll screen each kid on the way into each building also as a double check.
Okay. Thank you, Larry. So the next question was about the bus protocol, which you just did. For the bus tickets and temperature, what if a parent works and leaves before the bus picks up their child?
Yeah, that's a big question. And if the parents are cooperating with us and looking out for the safety of everybody, then they'll need to treat their kid who is sick like a sick kid and keep them home. And that's what we would expect parents to do.
If I'm planning on dropping my child off in the morning, can they ride the bus home, and do they still need a ticket to ride home from the school?
Kelly, you can do whatever you want because you're a great parent. No. You can, you absolutely on the survey can say that your kid is taking the bus to school and not taking the bus home, or being driven vice versa, whichever direction you're going to do it. There's not a ticket to go home. So, the child's been in school for the day and we've been with them. And if we think there's a reason that they're not healthy, we wouldn't put them back on the bus. So, let us know on that survey what you expect most days the child to do, ride the bus in the morning or not, ride the bus in the afternoon or not, and then do the tickets in the morning on the way into the building.
Next question. Are the kids still going to move from room to room in the upper schools, or are the teachers going to move?
I don't know if we came to a final decision, but I think what we were talking about as a group of principals was that the teachers would do the moving so that there's less spread and less chance of droplets from lots of different people in lots of different places.
Larry, can I just add that
Please.
I think what we've decided in some buildings is that cohorts of students
Right.
who are together for recess might move classrooms, but they would never go into a classroom if they weren't part of that cohort.
Right. So a cohort would be a smaller group under whatever the Vermont Health Department limit is for gatherings, right?
Yes.
Thank you.
Okay. Next question. What if you're a staff member who works in the school with your children? Are you still not allowed to be near the kids or in the kids' classroom?
So, the movement of staff within the building is not something we've finalized and have an exact plan on. In general, the idea is that if a staff member is not working with a group of kids, they should stay separate from that group of kids. And, in the case of a parent whose child is in the room, well, we know that you and your child are in contact at home, we assume. So I'm not entirely sure how that would play out. But I guess overall, if you don't have a work reason to be in that room, then you probably shouldn't be in that room.
Okay. Will parents be notified?
Mike, before you answer, let me ask if you could do *6 to mute your phone. If your phone ends in 95 in particular, I think we're getting a lot of reverb from you. I'm going to go check to see if I can admit somebody else right now while Mike asks the next question.
Okay.
There we go. Good, I did. Okay.
Well, all right, Larry. Will parents be notified if a student in their classroom is sent home as potentially sick?
I don't know the answer to that yet. The nurses are working with the guidance to let us know how that procedure will be, unless one of the principals has newer info than I do, one of the other principals. Anyone have anything newer?
During the press conference yesterday, they did say that they will do contact tracing if a student in a certain classroom tests positive. So you may be notified through the contact tracing, but that would be a decision from the health department, not from us.
And now I just wanted to add, this is Sherry from Orleans. I just wanted to add that would only be if a student tests positive for COVID. I think the question was, would parents be notified if a student in their classroom is sent home as potentially sick? So certainly if a child has a fever or a child has symptoms, we would not be sharing that information as that is confidential.
Right. This is definitely a trickier question to answer as well, considering when we get into flu season, right? And some of the symptoms of COVID and the flu are similar. Okay, next question. If a student or teacher tests positive, would the entire class or a contact trail need to quarantine for 14 days?
I'm not sure what the guidance is from the health department about that. Does someone else have that?
I can answer that. This is Sherry again. I just read the guidance, and updated guidance did come out yesterday. And what the Vermont Department of Health is saying is that if someone tests positive, they would want to be consulted, and Bev Davis, our superintendent, would work in conjunction with the Department of Health to make a decision on next steps. I know that sounds kind of vague, but that is the guidance that we have.
Great. Next question. What happens if a child cannot leave the mask on or their mask on?
So I'm not exactly sure what you're asking, but let's say we have a little kid who wants to play with it a lot. And so what our teachers will do is teach them how to kind of live with it on, and why it's important, and what the issue is. And what the experience from the daycares and other summer programs is that even the 4-year-olds are really okay with it, that masks turn out to be something that the adults worry far more about than the children, which is something that happens with a lot of things. If it's a medical issue that we're talking about, then the doctor needs to certify that the child cannot wear a mask. But if the kid's just playing with it, we're pretty good at teaching kids how to do the right thing. And that's the approach we start with and make sure that they follow it as quick as possible.
Next question is similar to the mask. So when will students get a break from wearing a mask, and how many hours a day do we expect the students will wear them? So the new guidance that just came out might have changed this a little. So one of my colleagues might fill this in, but we're going to work to create mask breaks when they're outside and can stay separate. But if they're on a team or if they're playing together, or certainly while they're in the building, they need to be wearing their mask. Is there someone who has a more thorough answer on the team? Some other principal can add to that?
I just think one thing that I'll add, Ms. Jenna Lawrence from Barton, was I was having a conversation with one of my teachers today of just kind of trying to be responsive to the needs of the group. And we're very much, as we talk about prioritizing the social, emotional, and health needs of our students, it's just being responsive to, if you're recognizing that they need a break, that we're going to provide that. So yes, we're going to definitely work to schedule those, but we also want to be very mindful of just, it might be needed and maybe it wasn't scheduled, but we're going to take it. So just trying, again, to do our best to be responsive to the needs of our students and our teachers.
Okay. Next question, how will student absences be handled given our current situation? Is there a certain number of days a student can miss without an issue?
So I don't think I have the latest on this. Another principal, does somebody have, is there an update to our regular attendance policies?
We've seen no updates to our attendance policies, and it's something that we haven't really talked about as a team yet.
Okay. So I think the thing to take home about this, or to remember about this, is that, you know, we have a set of policies and rules that encourage attendance, and we also have a bunch of blunt instrument tools that we can use that we would probably not use. We're not going to be referring people left and right to truancy in situations where we understand what's happening and we've talked with parents and we've communicated. You know, so we'll have to get back to that one. So that's one that we'll record as something we need more guidance on, and we'll get back out to parents on with more details.
Okay. Kelly asked a question. Kelly Turgeon asked a question about mass breaks. Was that Jenna and Larry's answer? Does that satisfy Kelly, or do you have a follow-up?
Yeah, that's fine. Thank you.
Thank you, Kelly.
Okay, next question. If in the classrooms, the desks are 6 feet apart, is it necessary to make students wear a mask when with social distancing and things like that?
So far the guidance from Vermont Health Department and AOE is that yes, it is necessary.
Okay. Will there be more than one emotional support / mental health advocate available at each school?
So I couldn't say for sure there's more than one, but here's what we've done. We have worked with the school board and some creative financing and grant usage and stuff to increase from anywhere from 1 or 2 days a week. Some schools had only 1 or 2 days a week of a school counselor, to now every building, all 6 of our K-8 schools have a full-time school counselor in the building. So we've all gone to full-time counselor, and that is huge. It was necessary before COVID because of the state of the world and all sorts of things about kids that they needed the supports, and it's doubly necessary now. In several of the schools, there's other supports that are not specifically geared to mental health, but will end up giving supports to kids, like social emotional learning specialists or coordinators, people who have a lot of experience working with kids, with helping them to work through their emotions, their reactions. I actually have the zones of regulation on a board behind me, that which is a strategy that we use with kids to help them understand how they're reacting. So there will be a fair amount of support and an increase over last year.
Yeah, Larry, I'll also add that we're also in the process of contracting with an organization called We Are Hope, and they do work around anxiety, working with students who are experiencing anxiety. They'll also work to help train staff on supporting kids who are feeling anxious, as well as what they call emotional CPR. So We Are Hope is the organization, and they do have a website, and they've been working in other Vermont school districts as well.
Thank you.
Okay, next question. If a guardian or caretaker has a fever, do we keep our children home or child?
Does another principal have the guidance on that? I'm not sure what the rule is. Sounds like
Our school nurses are working to put out more information, but at this point, we have not been told that if a parent has a fever, their child has to stay home.
Next question is, we will be going out of town. If the current guidelines are still in place, do the children have to stay home for a 14-day quarantine? And if so, how can they access their work?
So for the kids who are enrolled in physical in-person school, in those cases, what would happen is, yes, you have to follow the quarantine rules of the state. It depends where you're going, and there is a map that the Vermont Health Department publishes that shows different counties across the eastern half of the United States and which ones require what kind of quarantine. So I would check that map before you go so you know what the rule is for that area. And then, yes, you have to quarantine, follow those rules. And what you would do is contact the teacher and see what work can get sent home, just like any extended absence that happens during the school year in a regular school year. And we will, work with an absent child to help them get what work done they can, and certainly to catch up when they get back.
Larry, let me jump in. I just put the map into the chat for the people that are accessing us via Meets. This is Steve Owens, incidentally, from Albany. And also, I'm wondering maybe we could put a link to that map in our on our website someplace.
Okay. Next question, will each school have a full-time nurse?
So, not necessarily. We're working to have enough nursing coverage. Different buildings have had different numbers of days of nurses over the years, and we're working to increase that if we can. There's not a lot of nurses looking for school work, so I'm not sure how it will play out.
Okay. Have air circulation systems, the HVAC systems, been installed or upgraded in schools?
So every building has, various kinds of air circulation, heating, venting, AC, HVAC, installed in the buildings. And what we're doing is using a grant that came out through Efficiency Vermont. Our director of facilities is working with each building, with the custodians, with the air systems, and with a vendor to upgrade as possible, to replace parts that need replacing, and to ensure that they're working well. One of the specific upgrades is that we're increasing the filtration level, I guess you'd call it, of the filters in the system. I don't remember the numbers, but instead of 6, we're going to 7 or something like that, so that it's a slightly better filter. And that's where possible, and where systems that can handle that. But there's someone working on making sure each system is in good shape.
Larry, this is Steve again. I'm going to jump in. I also know from talking to our facilities director, Joe Houston, that the isolation rooms are going to be cut off from the general school filtration system. And I think that's an important point, because it means that if somebody is isolated because of illness, whatever germs they have, therefore, will not go into the general air circulation of the building, but rather will be vented directly outside the building through the wall, through systems that we're putting in place specific to those isolation rooms.
Thank you.
Okay. Next question. For those who have elected for remote learning, if the parents find that their child is not doing well per the new model and are falling behind, what are the steps they would need to take to facilitate a return to in-person learning?
So before we would, work on returning, what we would do, it was Angelique Brown and I would work with the parent, the kid, the teachers, to try to solve those kinds of issues and find ways to make it work. And then I guess if that doesn't work and there is a problem that is big enough that a transfer is needed, then we would work that out on an individual basis. But again, the main goal is to try to make it work so that the child has a successful experience.
Okay, so that's the last question on the chat, Larry.
Okay, so at this time, if you're calling in from a cell phone,
sorry, we got one more.
We'll come back to it in a moment, and you have a question, if you're already unmuted, then you can say, I have a question, and then we'll let you go, and we'll listen. And if you are not unmuted, you dial *6. That should unmute your phone, and you can ask the question. While you're muting and unmuting, let's get that last chat question, and then we'll call on people who have questions. I'll probably refer to you by your last 2 digits of your phone number. Those of you on the phone, because that's all that shows up. I don't know names, and I don't know the rest of your phone number, just the last 2 digits, maybe an area code too, but it doesn't tell us exactly who you are. So think about your phone questions, and we'll take that last question, Mike.
Yeah, okay, so this question is about how it'll be determined if schools are shut down as they were in March, and would it come from the state, or is it I'm assuming maybe a local decision?
So there's a couple ways it could happen. Certainly the state could react to statewide information, statewide numbers, and do like it did in March, and that we have absolutely no control over, no say in. The governor and his task force will do what they see fit with the powers they have. If we had reason here in this area to be concerned, then Bev Davis, our superintendent, would consult with the Vermont Health Department, local health officials, and the Vermont Agency of Education to make decisions about opening or closing or changing what we're currently doing.
Yep. One more question, sorry.
Okay.
As for the temperature, what if you have a student that has a medical condition which causes high temperatures to come and go with no warning? Do you send them home every time?
So not necessarily. I think in a situation like that, and I don't know the particulars of that kind of condition, what we would need to do is have an individual health plan in place that would include the doctor's information. Hopefully the doctor could be at or remote into the meeting, and to create a plan that makes it really clear what would trigger what and how we would make a decision, but use the doctor and the medical information to really think that through carefully and make the right choice for that child. That's what we would probably have to do in that case.
Okay. We have two questions that are similar, so I'm going to read them together if that's okay.
Okay.
How has the student to staff ratio changed, and then how many people are allowed in a room at a time?
So the ratio isn't a set thing. It's based on enrollment. And so overall in each of our buildings, there are fewer kids attending in person, and in most buildings about the same number of staff that were employed last year. There are a number of staff from around the SU who will work in the remote academy, so that would change things in different classrooms at different times. The number of people allowed in a room at a time depends on the size of the room. And what we've generally done is we've measured each classroom, taken the total square footage, estimated 36 square feet per person, which is if you had a 6-foot square around you, that would be how much space you would need, and then done that quick math to say that a room of 792 square feet allows for 18.6 kids. And I made those numbers up. I might be a little off, but I think it's close. And then we take away a little of that space for furniture and bookshelves, and know that we can't really do 18. We can really do a little less than that, and use that kind of a formula to figure out each space and how we can distance kids, And then we're looking at seating arrangements and kinds of furniture, tables versus desks versus other options, and keeping the guidelines in mind to make sure that we're creating a space that is as safe as possible and still conducive to some learning.
Okay.
So
we got one more question.
Okay,
right?
one more text. Then we're going to stop text for a little bit. The chat for a little bit, go to any phone, and then come back to any chat that comes in. So keep track of where we leave off.
Okay, so the last question in the chat is a middle school student who's curious about how restrooms will be accessed.
Through the door. No, I'm sorry. I thought a middle schooler would like that kind of answer. It depends on the building as to which kids use which bathrooms. In Brownington, the middle schoolers use the bathrooms by the gym. They're single-use bathrooms. Kids will be allowed to use the bathroom. They'll need to wear their mask. Beyond that, I don't know the exact details, because the staff and I will work together in this building to come up with exact procedures, and then each of the principals will create exact procedures for how many kids, when, where, depending on the size and shape and location of the bathrooms in each building.
Okay. Thanks. All right. So, chat's off.
Okay. So I'm glad I see the chat, and I'm glad the middle schooler liked my answer. I want to meet this kid at some point. But anyway, if you're calling in from a phone and you have a question, now's the time to say something along the lines of, I have a question, And then if no one else is talking, ask your question. If someone else is talking, please wait. And then we'll do one at a time and try to get everyone's questions in. So telephone people, go. Oh, and if you don't remember how to unmute, *6. In the education trade, we call this wait time.
Question.
Yes.
What if we have signed up our child for residential school, but we may feel like we want to change our mind and do online school? What is the process for that?
So if we're talking about now in the next week or two, is I would say call your principal and talk it out with your principal from your local school really, really soon, because we're using those numbers to figure out staffing, which isn't quite finished yet. If it's once the school year starts, then it's more like the process, the intention is that kids stay in whatever school they go to. And the process really, once school starts, is more about like a transfer where, we try to work out the issues that exist in the building that are making something not feel right. And if we can't, then we work out the details for some kind of transfer. And that's done as an educational team, the parent, the teacher, the principal, and the kid, depends on the age of the kid, I guess, work that out together.
Thank you.
You're welcome. Other questions from telephone people? Other questions from anybody in the online? Anyone who prefers, instead of typing their question in the chat, anybody who'd rather ask their question out loud, who's on a computer? This is a time to do that. Anybody who has any kind of question now about in-person school in Oxford, this is the time, because we're gonna, if we don't get any others, we're probably gonna wrap it up in a couple minutes. Oh, it looks like we've got a couple questions in the chat. Thinking of winter apparel and car heaters, if on initial temp screening a child has a temp of over 100.4, are they re-screened in 15 minutes or so, or are parents contacted immediately? I don't think we've worked out that exact procedure, but generally if the temperature is above 100.4, the plan would be to contact right away. And we might, that might be something the nurse talks directly with the parent about and works that out.
Yep. The next question there is, will recess look the same for all kids?
Recess will look a little different than it has in the past. There will be smaller groups of kids. Most of the play structures will be closed. Oh, no, I'm sorry. We changed that a couple days ago. The younger kids will use the play structure for a week at a time, and then they won't use it the next week. And the reason for that is that the guidance right now is that we are supposed to sanitize the play structures, the slides and the swings and the grabby bars and all that stuff between each group of kids. We can't do that. We don't have the staff. We don't have the time. So instead of cleaning and sanitizing the monkey bars after every group of kids, we're going to say week 1, let's say the kindergarten and first grade combo group will use the play structure. Week 2, the 3rd grade will use whatever, whatever the rotation is. So recess will look a little different that way. We are going to encourage kids to run around a lot. That'll look the same. We're going to encourage them to play and to let off a little steam. And we're going to not let them hit and push each other still. So a lot of it'll be the same.
Okay. Will the online learners and students who attend in person be able to converse or participate in classes together?
So they will not be in classes together. The online academy really is going to, in a sense, become a 7th OXU school. Not in legal senses, but in a way it's becoming a 7th school. And those kids will take classes together, do stuff together online. We have not talked much as a leadership team in terms of how can we maintain connections between the remote kids and the in-person kids. And it's a topic that we probably need to discuss because God willing, or whoever willing you want to say there, they are back together the following school year in a world that looks a little bit more like we all want. So that's a good one to work on, is how can we keep them in the fold somehow?
Next question. I've chosen to homeschool, but is there an option of sending my children a few days a week?
So the rules for homeschooling allow homeschooled students, and I just want to be clear that we're talking about, if you're talking about homeschooling, which is home study, which is a state of Vermont specific set of rules. Lucas, if you could let us know, are you talking about like true homeschooling or the remote academy? The true homeschooling has rules that allow students to participate in they have to do 3/5 of their core subjects at home. I think that number is right. And they are allowed to participate in things like specials or after school activities. But for the most part, their core instruction has to be done at home. For the remote academy, we have no plans right now that would allow kids in the remote academy to take some classes or come in a few days. We're not doing any at K-8. We're not doing any direct hybrid where kids are in and out of the building at different times like that. We're not doing that for the K-8 schools.
This is next question. Will PE art music be offered?
Yes.
Yes. Next question was about the school calendar. Jenna answered that about being found on the OXU website.
We are going to start on September 8th by executive order. And we will, the new calendar is there that shows a few changes in in-service days from what we published back in the winter. But for the most part, it will look similar to a normal year in terms of when vacations are, things like that.
Larry, this is Paul Simmons from Irisburg. I just want to clarify that all students will be starting September 8th, including the kindergartners.
Yes, thank you.
The last thing here, this might even be a good segue. Thank you all for all you're doing. We know this can't be easy for you to all figure out. We appreciate your dedication, time. That this is very tough for everyone.
Thank you. Jennifer, yes, the first week we're going to be dismissing 1 hour earlier than typical. So, in Brownington, that would be 2:30. In some schools, it's 2:15. It depends on what your typical dismissal is, but 1 hour early to give the teachers some time to reflect on how the new procedures went, to give kids a little bit of a break and to figure things out to improve for the next day. And Kelly, no, we don't yet have a date for the info meeting for the individual schools. At our last principals meeting, we talked about doing it probably the week before school opens. So sometime the week ending September 4th. But I don't know if any schools have scheduled theirs yet. I know Brownington has not.
But I think your response is good because we really want to get our teachers back in the building to help work through some of the specifics. So right. I would assume that week before school starts.
Yeah.
And principals are also writing letters with changes in building specific procedures. Glover's went out tonight. I know everyone else is working on one as well.
Yeah. So it is 7:30. And we didn't set an exact end time. If there's at least one more question, and then we'll start to wrap up. There isn't a specific wrap up, but I'll ask these now. I'll look at these next questions. Is there a Google Meet setup for specifics for those who are remote learning? Yeah, it's not scheduled yet, but probably sometime next week or the beginning of the week after. So Angelique Brown and I, as co-principals, we're still settling some questions that have to come first, like who the staff will be. Once we kind of settle that in the next day, I think the next day, then we can begin planning with them and making some of the decisions that will help to inform parents. So that's probably coming in the next week or two. I mean, certainly in the next week or two. We just don't know when. So Roberta's asking if principals are in the buildings and able to be reached. Yeah, we're all working, and most of us have been on or off working pretty much all summer. So leaving a voicemail with your principal, if they don't actually answer the phone, or emailing them is going to be a good way to get in touch. We're all here at our buildings at least parts of every week. We're all trying to have some time that's down away from school. I'm not sure we're successful very often, but we are definitely able to be reached by telephone or voicemail, stuff like that. Any other questions?
Steve Owens here. The other thing I want to mention is our email addresses are just our first initial and last name at ocsu.org. So I'm Steve Owens, so it's SOWENS at ocsu.org, and the same protocols for all of the other principals. Makes it easy to email.
Does anyone else have any other questions, either from the phone or on chat, or anyone who wants to ask it on video? Now's your chance, or certainly email any of us, or call any of us.
All right.
Going once, going twice. Sold. The meeting is adjourned.
All right.